Everyone, today we are going to talk about disorders of the urinary system. This is actually a pretty short lesson. There's not a lot of disorders to talk about, and the information is pretty straightforward, so let's go ahead and get started. So first we're going to talk about cystitis. Now, if you take the word cystitis and you break it apart into cyst and itis, think back to foundations of health science or health team relations, and we know that cyst means a sac containing fluid, or most of the time it refers to the bladder, and itis means inflammation or infection. And so cystitis is just inflammation of the bladder, and this is typically caused by urinary tract infection or a UTI. So this basically just means that the bladder has become inflamed, and usually it's caused by the bacteria E. coli. And the symptoms of a cystitis or UTI are just dysuria. And dysuria just means painful urination and frequency. So if you go to the bathroom a lot and it's really painful, that can be symptoms. It's like a burning sensation. That could be a symptom that maybe you have a UTI. And UTIs can really be caused by a lot of things. Well, it's caused by E. coli, but the E. coli getting into the urinary tract can be caused by a lot of things. It can be caused by not cleaning yourself frequently enough, not wiping the proper direction when you go to the bathroom, or it can be a complication related to sex. It's more common in females simply because in females the urethra is much shorter. So the urethra is that piece that connects the bladder to the outside of the body, basically, and that's how we urinate. In males, that urethra is much longer because it actually has to travel all the way through the penis. In females, the urethra is very short, and so because it is shorter, bacteria can get into the bladder much easier. And then a prescription for cystitis is just antibiotics. Typically, they prescribe something like amoxicillin, and there's also a medication called AZO that you can take to help relieve some of the symptoms like the burning and the frequency. Enuresis is just a fancy word for bedwetting, and this typically occurs around the age of 5 and is part of your normal childhood development, and most children outgrow bedwetting on their own. Now, if someone was experiencing bedwetting much later into life, that could be a symptom of something further. I mess this up every time. Glomerulonephritis. Okay, glomerulonephritis. It's a very hard word to say. This is the inflammation of the actual kidney. And with this condition, you can have acute or chronic. Acute meaning that it doesn't last for very long, it develops kind of suddenly, and it may occur after a strep throat or some other type of infection, but it's curable. Chronic develops slowly over several years and often leads to complete kidney failure, which is a long-term condition that cannot be treated as easily. Incontinence is a fancy word for saying involuntary urination or not being able to control the release of urine. Incontinence is something that we typically see happen in older adults, especially adults that are dealing with dementia or Alzheimer's. They tend to forget or lose that control of their bladder or the sensation that they need to go to the bathroom, and so they start to experience incontinence issues. And that's when we start to see people wearing those adult diapers, and that is an incontinence thing. They wear those because they may accidentally go to the restroom even though they don't mean to. Some treatment options for incontinence, there are some medications that you can take, but really the best thing to do is these exercises called pelvic floor exercises. And it's basically when you're contracting and moving the muscles of your pelvic area in order to try to relearn or regain that muscle control that holds urine in. Caffeine is a diuretic, which makes us want to go to the bathroom more. So avoiding caffeine can help with incontinence issues. And of course, wearing those absorbent undergarments or adult diapers. Bladder retraining often involves the gradual increasing of time until the urination needs to occur. So you can kind of train yourself to hold your bladder for longer periods of time, and that will help with incontinence as well. Renal calculi is a fancy word for kidney stones, and these are made of crystals of calcium phosphate and uric acid. They gradually get larger until they completely block ureters. So remember, we're looking at the kidneys, and then there's ureters that travel down to the bladder. So those ureters can get blocked by these crystals, and that's what we know as a kidney stone. The first symptom of a kidney stone is typically really severe pain, which then leads to other symptoms like nausea, vomiting, frequency of going to the bathroom, chills, fever, and hematuria, which is blood in the urine. A diagnosis for kidney stones is looking at your symptoms. Typically, we can diagnose that way. We may have to perform an ultrasound to be able to see the kidney stones or an x-ray. Prescription is to increase your fluids to help flush out the kidney stones, and medications. If the kidney stones are really large and they're not going to be able to pass on their own, sometimes we do have to perform something called a lithotripsy. And a lithotripsy is basically a procedure where we use friction and sound waves to break up the kidney stones into smaller pieces so that you can flush them out of your system. It's basically shock waves that help break up the stones. Renal failure, renal means kidney, so renal failure is just kidney failure, and this occurs when your kidneys completely lose the ability to filter blood or filter the waste products from the blood. You can have acute or chronic kidney failure or renal failure. Of course, again, acute is it might be very sudden, caused by some type of infection, and usually is more curable. Chronic is ongoing, long-term kidney failure that typically cannot be cured very easily. There are 5 different stages of renal failure, and typically when a person reaches stage 5, their kidneys are not functioning really at all, and they have to get regular dialysis or a kidney transplant. Oliguria is a really, really tiny amount of urine being produced, and that's a really early sign of kidney failure. If you're not able to produce urine, that means you're not producing the waste product, which means your kidneys are not filtering it. An interesting fact about the renal failure is a celebrity that most of you have probably heard of that has had a kidney transplant is Selena Gomez. Typically when we're in class, I show a video of her being interviewed about her kidney transplant process. So if you want to, you can just Google Selena Gomez kidney transplant and watch those videos. It's really interesting to see someone in the celebrity world who's had a kidney transplant. And then dialysis, which was the other option for renal failure, or sometimes referred to as hemodialysis, is what we use to help treat patients whose kidneys are not functioning anymore. And this involves the passage of blood through a machine that will basically filter their blood for them, and it separates the waste product from the blood. Dialysis serves as basically a substitute for your kidneys, but because your kidneys are not functioning, you actually have to go get dialysis pretty frequently. The blood is taken from the patient and then flows through a machine which is filtered. In some cases, this can be done at home if you have access to that type of machine or can afford it, and then in some cases you have to go to a clinic. The procedure typically lasts 2 to 4 hours, and sometimes you have to go 2 to 3 times a week, and in some cases with people who have really severe renal failure, even up to 5 times a week. That is everything for disorders of the urinary system. So if you have any questions, feel free to reach out to me and continue working on your urinary system project. Have a good day.